We're taking your calls today for Dr. Zorba Paster.
There are 3 lines open today. If you have a question, the number is 608-270-9933. Hi, Zorba. Good to see you.
I don't bungee jump either.
You just go skiing. I die with that, too. And you're a little cold, so...
yeah, that's right.
A little hoarse, but that's okay. We'll get through this. We'll start with Alice in Milton. Hi, Alice. What's your question?
Yeah, I had surgery on my thumb on autoclasis. When I poop, I pack out a pain and it burns.
On your gum?
On the thumb.
Oh, on the thumb.
Oh, on the thumb. Yeah, so she's got pain in her thumb right now. Well, you know, a pain in the thumb can be a lot of different things. It often can mean a nail infection, that you have it if there's any trauma involved. There could be trauma involved. Putting ice on it, taking some ibuprofen, maybe 400 to 600 milligrams 3 times daily. Those are usually good things to do.
I think she said she had surgery, right?
Yeah, she had surgery.
So she had surgery, so the ice would be important, and after surgery, often something to take for that analgesia. That's really important.
If the ice makes it hurt, is that
not
okay?
What you do is you do it less, because some people then will put it on for 5 minutes, then take it off, put it on for 5 minutes, and so on.
Okay.
Sometimes people just leave it on too long.
Okay, great. All right, let's go to Jim in Verona. Hi, Jim. What's your question?
Hi. I'm so glad to talk to Dr. Zorba Paster. I've got his cookbook, and he's got some great recipes in there.
Yes, he does.
I appreciate that. And I do have a question for him. I had a Lupron shot today for my prostate cancer, and I'm wondering, is there a lot of side effects to that, or how long can I keep taking them? Sure. Every 3 months they're giving it to me.
Well, Lupron it's an anti-testosterone medication. So it stops testosterone, which actually is involved with prostate cancer. If you have prostate cancer, testosterone can make it grow more. So if you take the Lupron shot, it actually is very good as a follow-up, especially if you had surgery or radiation. And there's a definition of how long you take it. Some people take it for 1.5 years. Some guys take it for longer. That's something you have to talk to your doctor. It's individual based on essentially what the results were when you initially had your diagnosis.
So this is after treatment or instead of treatment?
Usually, well, it all depends on where you are. If you have metastatic prostate cancer, it can actually be the treatment that you have, and you may not have had either radiation or prostate cancer, so or rather prostate surgery. So it kind of depends on where you are. But in any case, it keeps prostate cancer from growing in your body. That's what it's made to do.
Okay, let's go to Bonnie now in Madison. Hi, Bonnie.
Hi. I'm struggling with thick phlegm that's driving me crazy, that's going into my throat. What can you do about that?
So what exactly
Thick
is
phlegm?
You know, it's just this phlegm. So one of the things that people don't think about is putting a vaporizer on in their bedroom. Think about it. We spend 6 to 8 hours a day, hopefully it's 8 hours a day, in our bedroom, get an ultrasonic vaporizer, put it on, it reduces the phlegm, and then hydration is really the other way to do it too. People don't hydrate enough. So it's very important. Vaporize the bedroom, hydration, that's what you do. And then, of course, if it's clear phlegm, it's probably a viral infection.
Okay. Let's go to Teresa in Middleton. Hi, Teresa. What's your question?
My question is on COVID. I'm fully vaccinated. I have 1 booster, and I'm wondering how come I test positive for 2 or 3 days and then negative?
Well, first of all, you test positive because you probably had COVID. I mean, that's the reason that you may test positive with a COVID test. I mean, it's about 95% correct in terms of positivity. The false negative rate is high, but the false positive rate is very low. So if you're testing positive, you had COVID sometime along. The shot does not make you test positive for the nasal swab. So in other words, if you're positive for the nasal swab, you had COVID and you just weren't aware of it if you didn't have any symptoms.
And if you have COVID, you can test positive for
a long
several
time.
days before you test negative.
Right, exactly.
Even without, and have no symptoms.
Right, absolutely.
All right.
And most people do not have any symptoms.
All right, we have 30 seconds left, so I don't think it's quite enough time to take another call. So, what's new?
What's new? Well, what's new in medicine is that we know that the Mediterranean diet in women has is incredible in reducing the risk of heart attacks and stroke, and that's the latest data. So it shows the Mediterranean diet is really something that everyone should be on. Fruits, vegetables, legumes, nuts, fish twice a week, and that's what we've learned.
All right.
So.
Mediterranean diet.
Yeah.
Check out Zorba's cookbooks.
He's a good cook.
Sold it wherever you buy your books. Thanks, Zorba.
Great to see you,
Thanks for
Zorba.
calling in, everybody. We'll do this again next week.